Okay, I'm going to go ahead and introduce myself. My name's Katie. I'm going to be doing a physical assessment on you today. What's your name?
Kai.
Okay, so before we started this whole deal, I went ahead and washed my hands. We did his vitals. His height was 6 foot, weight 160, blood pressure 120, his pulse was 70, respiration 16, and temperature was 98.1. We checked cranial nerve 2 by doing the Snellen eye chart. His vision was 20/20. When he walked in, his gait was appropriate. He was alert and oriented ×4. Mood and affect was appropriate. He's dressed clean. His appearance is clean. Some things we didn't assess, but we would be the penis and rectum area. I would inspect the penis for the condition of the hair, make sure there's no nodules, masses, color of the penis is okay, there's no drainage from the penis. Make sure that the scrotum is symmetrical. After inspecting it, I'd palpate it. No tenderness, edema, anything like that. I'd also palpate the inguinal opening, and then I would do the prostate exam, which prostate's a heart-shaped gland, and then inspect the rectal area for any hemorrhoids. The other thing that we just verbalized and didn't actually assess was the breast area. I'd inspect it, make sure the skin is smooth, there's no abnormalities, that the color's even, and the nipples are symmetrical. Then I'd palpate it for any nodules, masses, make sure there's no drainage of the nipples. And when I'm palpating it, I'll do it in a circular motion. I'd also identify the nodes on the breast. There's the central node, the pectoral, which is the anterior node, the subscapular, which is the posterior node, and the lateral node, which is along the humerus. Now I'm going to go ahead and get started. I'm just going to go ahead and have him take his shirt off now, just so it's easier for the exam. I'm going to start off by inspecting the skin. Make sure it's pink in color, that there's no lesions, no moles, no edema. Then I'm going to go ahead and there's no abnormalities there. And then the moisture of the skin, it's dry, which is good. And then the texture, smooth. And then we're going to go ahead and check the tuber, which is on the clavicle, and it's 3 seconds. It's appropriate for age. And then vascularity, just make sure there's no bruising on the skin or anything like that. Now I'm going to go ahead and palpate the skin using the back of my hands. Sorry, my hands are cold. The temperature of the skin is normal bilaterally. The texture of the skin, I noticed that it was smooth and firm. And at this time, I'd also be noting if there's any thickening of the skin, which there wasn't any on his. And like I said before, I went ahead and checked the tuber, which is on the clavicle. Now I'm going to go ahead and look at your nails. Both hands, please. And then I'm inspecting his nails. They're pink in color. They're also flat-shaped. There's no lesions. They're clean. Now I'm going to go ahead and palpate it. I'm going to check that 3-second capillary refill. So he did have less than 3 seconds. And then they were smooth, round in texture. And now I'm going to go ahead and look at his hair. I am going to put on some gloves for this. You would typically. I'm just inspecting the hair right now. It's brown in color. It looks like it's evenly distributed. It's thick, clean. Now I'm going to palpate. I'm just going to make sure there's no lesions. Looks like it's shiny, coarse in texture. And then as I'm doing this, I'm also inspecting the scalp and the head and skull. It looks like it's normal. It's a normal cephalic shape. Alright, so his head and skull, it's normal cephalic shape. It's symmetric within normal limits, and while I was palpating, I noticed that there was no masses, no lesions, no scaliness, and I didn't notice any inhabitants like lice or bugs or anything like that. So now I'm going to go ahead and look at the external ear. I'm just inspecting both sides, making sure they're equal bilateral. I noticed that irregular, the mastoid process, and I just made sure that there was, no lesions or masses on both sides of that. I also, I'm going to go ahead and palpate those, make sure, there's no tenderness on the tragus or the mastoid process or the auriculal again. Did you have any tenderness while I was doing that? Okay. And now I'm going to go ahead and assess your acuity. Cranial nerve 8 first. I'm going to do the whisper test. So actually I'm going to have you sit on this side for this one. And I'm just going to whisper 3 words in your ear, and I'll just want you to let me know what they are.
Red, orange, yellow, green.
Okay. And on this side?
1, 2, 3.
Alright, you can go ahead and have a seat back over here. So, that was just cranial nerve 8, and it is intact. Now I'm going to go ahead and test the Weber test. So I'm going to use my tuning fork on this. I'm actually going to hit this on my hand, and I'm going to put it on your forehead, and I just want to make sure that you can hear it in both ears, okay? You can hear that in both ears? Okay. So now I'm going to go ahead and do the Rhine test, and I'm just going to place, I'm going to hit it and place it on the mastoid process, and the air should be greater than the bone conduction. So I'm going to go ahead and do that. Tell me when you can stop hearing that. Okay, so he has no conductive hearing loss. So now I'm going to go ahead and inspect the inner ear. Okay, so doing this, you use your otoscope and you actually use it upside down. Okay, and while I'm doing this, I'm looking at the canal, the umbo, manubrium, the short process, and I notice that the tympanic membranes are really gray, and that the cone of light is pointing to the umbo. Now I'm going to go ahead and make sure the other ear is the same way. Alright. And everything looks good in both of his ears. Okay, so now I'm going to go ahead and inspect the eyes. Just going to look at the external eye first. I'm noticing that the eyebrows, they're symmetrical bilateral. There's no lesions or scaliness. The eyelids are also equal and symmetrical. I'm going to have you look down for me. Open your eyes and look down. Okay, and when I'm doing this, I'm looking at the lacrimal apparatus, make sure there's no swelling or redness. And then now I'm going to have you look up, and I'm looking at the conjunctiva. It looks like it's moist and clear, and I'm noticing now that the sclera is white and it's clear also. Now I'm going to go ahead and just palpate the external eye. I want you to tell me if there's any tenderness or anything like that. Okay, I notice that there's no masses. No swelling. Is that hurting at all?
No.
Okay, and his eyelashes, they're also evenly distributed as well. So now I'm going to go ahead and get out my pen light. No, I was forgetting something. And I'm going to check his extraocular movements. So I'm just going to have you follow this. And as I'm doing this, I'm making sure that there's no muscle weakness and that everything is normal parallel. Alright, now I'm going to have you follow my finger in, and this is just checking accommodation. Okay, And now I'm gonna check your pupillary reflection to light, so I'll just look straight at me. And I want to check this bilaterally. Okay? And checking this, his pupils did go from 4 to 2, which is normal. And while I'm doing that, that is checking the cranial nerves 3, 4, and 6. Now I'm going to go ahead and check his peripheral vision. I'm going to have you hold this up over one eye for me. And you just tell me when you can stop seeing this.
Yeah.
Okay? And then,
Yeah.
okay? Now I'm going to have you hold it over your other eye, and we're going to do the same thing.
Yeah. Yeah.
Okay, that works. So that's, his peripheral vision is good. And now, I'm going to go ahead and inspect the internal eye. For this exam, I use my ophthalmoscope, and I actually dim the lights. So I'm going to go ahead and dim the lights. Make sure that you can, yeah, okay. So I'm going to go ahead and dim the lights. And to check the patient's right eye, you want to look with your right eye. So I'm inspecting his right eye. I noticed the optic disc, it is a creamy yellow color, and it's round. I also noticed the arteries and the veins, and the red light reflex is also visible. Now I'm going to check the left eye with the left eye. And the red, I noticed the optic disc, the arteries, the mandula was visible, and the red light reflex was also visible. So I'm going to go ahead and turn back on the lights. And I'm going to go ahead and get a drink of water. And then I'm going to inspect the nose. Okay, so I'm going to inspect the nose and his sinuses. First I'm going to do external, and I'm just inspecting it, making sure everything's symmetrical. I'm going to plug your nose. Can you breathe? Just checking the patency. He has good patency. And now I'm going to palpate it. I'm going to also palpate your frontal and your maxillary sinuses. Tell me if there's any tenderness or anything like that. No tenderness? Okay. And now I'm going to go ahead and inspect the internal nose with the otoscope. Oops, I throw that away. That's all I want to. Okay. And I noticed that there's no deviation or perforations. The mucosa membranes, they're red and smooth. In the other nose, I noticed that there's no swelling or bleeding, no discharge, no polyps, nothing like that. So the internal nose is good. Now we're going to go ahead and do scent. So what I'm going to have you do is close your eyes, and I'm going to put something in front of your nose, and I just want you to tell me the scent. What scent you smell. So I'm going to have you close your eyes.
Chocolate.
Alcohol, yes. And now we're going to go ahead and do another one. So I'll have you close your eyes again.
Chocolate.
No. Okay. So I did alcohol and chocolate, and he had both scents, so that would be cranial nerve 1. So cranial nerve 1 is intact. Now I'm going to go ahead and inspect the mouth. You want to put gloves on for this one also. New gloves. And you're going to do the outer mouth first. So you're going to look at the lips, make sure there's no cracking, any lesions. something like that. You'll want to retract the lips when you do that. So I'm gonna go ahead and do that as soon as I get these gloves on. Alright, so I'm just going to retract the lips. Okay, and it does look like they're symmetrical, bilateral. Now I'm going to inspect the internal mouth. So I'm going to have you open your mouth. I'm just looking now. I notice that the mucosa is moist. The teeth are evenly distributed. For his age, they're straight. Open up again. I'm noticing that they're clean. There's no cavities or anything like that. I'm going to get my tongue blade and assess the tongue. So I'm going to have you stick your tongue out for me. Okay, and I'm just looking for the tongue. It's pink in color. There was no lesions, masses, or anything like that as I palpated it. And now I'm going to put the tongue blade in and just check at the uvula and the tonsils. So maybe stick your tongue out and say ah. Okay. Tonsils were a grade 2. There was no white patches on them. The uvula rose to midline, and as I noticed that the salivary glands, they were moist. This up. And now I'm going to go ahead and check some more cranial nerves. I'm going to check cranial nerve 5 first. I'm going to have you clench your teeth for me. And I'm just going to press on the temporal and masseter muscles. Okay? And now I'm going to do one more test. I'm going to get my cotton ball. And I'm going to put it in 3 locations. And I just want you to tell me when you can feel it. Okay? So his cranial nerve 5, it was intact. Okay, so now I'm going to check cranial nerve 9 and 10. I'm not going to check his gag reflex, but I am going to have you swallow. Okay, I noticed that 9 and 10 were intact if I would do the gag reflex. I'm also going to check cranial nerve 7, so I need you to frown for me. Okay, smile for me. Close your eyes real tight. Puff your cheeks out for me. Okay, so cranial nerve 7, it was intact. Now I'm going to check cranial nerve 12. Stick out your tongue for me. Okay, so he could do that also, so cranial nerve 12 was intact. Now I'm just going to inspect his neck. I'm noticing that the trachea is in midline. Now I'm going to have you touch your neck to your shoulders, front and back. Just checking the range of motion. It's intact. Now I'm going to have you shrug your shoulders for me. Okay, I'm just noticing that the C-spine, it is aligned, and I'm going to palpate on his neck. I'm going to palpate the trachea. Okay, it's good. And I'm actually going to have you sit here again because this is where I'm going to palpate for the thyroid. I'm going to give him a drink of water just to see if I can't feel anything. Here's this. Alright, and I'm just going to... Okay, I could not palpate his thyroid, which is normal. So I'm going to have, you can come back and sit over here if you need to. There you go. Okay, so it wasn't palpatable. I did it when he swallowed. And now I'm going to check cranial nerve 11. I'm going to push against his face and make sure that he can, resist that. So push this way for me. Okay? This way, and now I'm going to do both shoulders. There you go. Okay, so cranial nerve 11, it was intact. And on the neck, I also need to name the nodes, the lymph nodes on the neck. So I'm looking at the occipital, the submandibular, the submental, the cervical, and the supraclavicle on the lymph node area. And then I'm also going to check, after the neck, I'm going to check your spine. So I'm going to have you stand up for me. And I'm just going to run my finger along his back to palpate his spine, make sure there's no abnormalities. So I'm gonna have you bend over for me. Okay. Bend over and touch your toes. There you go. And I noticed that there's, okay, you can go ahead and have a seat. I noticed that there was no abnormalities in the alignment, so I didn't notice any scoliosis or anything like that when I was checking the spine. Now I'm going to check the lungs and thorax of him. I'm just inspecting right now. I noticed that there's no abnormalities in it, that the color it's even, and that his respirations, they're even, and he's not having any problems, so they're unlabored. And so I'm just going to have you breathe for me. Okay, I'm going to have you sit over there for me. And right now I'm just inspecting the AP. Okay, you can come in and have a seat again. And the normal AP transverse is 1 to 2 centimeters, and his was normal. I'm also 2 to 4 centimeters, I'm sorry. And okay, I can't remember the normal AP transverse, but his was normal. Okay, and now I'm just going to go ahead and I'm going to palpate his lungs and thorax. You tell me if there's any tenderness or anything like that. Okay, I'm going to have you sit over here for this one just so I can access your back too. Just palpating over the lung fields and the thorax, making sure there's no tenderness. Now I'm going to do tactile fremitus. So I'm just going to have you say 99 for me while I'm just checking.
99, 99, 99, 99, 99, 99.
Okay, and now we're going to go ahead and do it again.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, and just going to have you breathe normal for me. Okay, take a deep breath. Okay, I noticed that there was no uneven chest expansion, so that's good. And now I'm going to check his diaphragmatic excursion, which, okay, let me get my ruler out. Okay, so I'm going to check for this. So I'm just going to have you breathe for me. Okay, it looks like his was about 4 centimeters, which is normal, because normal is 3 to 5 centimeters. And now I'm going to do percussion on him. I'm just going to check for resonance and dual sounds. Alright, now I'm going to go ahead and do the back also. Okay, after I do percussion, I'm just going to auscultate the sounds also. Typically what you'll hear is, for your bronchial sounds, you'll hear them over the trachea and the larynx, and then your bronchovesicular ones, your bronchovesicular sounds, you hear them over like the major bronchi, and the vesicular sounds, you hear them over the peripheral portions of the lung. So I'm just going to go ahead and listen. Okay, I'm going to check posterior on that. Posterior now. I didn't hear any abnormal lung sounds. Okay. I'm not hearing anything abnormal on the posterior lung sounds also. Okay. Now I'm going to go ahead and start the cardiovascular system. I'm just inspecting right now. I'm not noticing any heaves or anything like that while I'm inspecting. I'm also going to have you lay back for me, and I'm just going to assess the apical impulse. So lay back for me. Okay, and now I'm going to just turn you to the left. Okay, you can sit up. And as I was doing that, I was just inspecting the apical impulse. I noticed that there was no thrills or any abnormal vibrations. I'm going to palpate as I did when I rolled him for the vibrations. There was no thrills, and I noticed that there was a normal rhythm. And now I'm going to also palpate the 6 points of the cardiovascular. So I'm going to have you lay back for me. There you go. And as I'm doing this, I'm just palpating the aortic, the pulmonic, herbs, tricuspid, mitral, and apex portions of the chest. So I'm just going to go ahead and do that. And after I get done palpating, I want to, okay, I didn't notice any, I noticed that all the rhythms were normal, that there was no, any abnormal vibrations, thrills, or anything like that. So now I'm going to auscultate those in all those 6 areas just to make sure I don't find anything abnormal. Okay, all rhythms were okay. I didn't notice anything abnormal, and I'm just going to make sure that the apical pulses match up with the radial pulses, so I'm just going to listen and feel. Okay, everything, they match up perfectly, so I was just, like I said, just checking to make sure that the apical pulse and the radial pulse match up, and I would do that for 60 seconds. Now I'm also going to check the peripheral vascular areas. So I'm going to check all of his pulses, make sure everything's normal. I'm going to grade them. Normal is 2+. So first I'm going to check the femoral. So I'm just going to check your femoral artery. Okay. I'm going to check the other. Okay, I noticed that. I'm going to give that a 2+ also because they were normal. And now I'm going to go ahead and check the ulnar and the radial. The ulnar, the radial is the artery that's closest to the thumb, and the ulnar's on the other side. And you don't want to do them at the same time. Both radial pulses were normal, and both ulnar pulses were normal. And I'm going to check the brachial, which is right at the bend of the elbows. Okay, I noticed that those were normal. I'm going to check the popliteal, which is at the back of the knee. Okay. And those were equal. The dorsopedialis, which is on the top of the foot. And then I'm going to check the Achilles pulses, which is at the inner heel. And I'm also going to check his carotid artery. You never do those at the same time. Okay, and they were all okay. I'm gonna give them all a 2+ because there was nothing abnormal that I noted. Now I'm gonna osculate for Brutes on those areas. Okay, and then the femoral, which is right here at the hips. So I osculated for Brutes in the carotid arteries, the femoral, and the abdominal. And then I'm gonna, while I was doing that, I was expecting the carotid artery and noticing the jugular vein. I'm gonna have you sit up for me, okay? So when he sits up, the jugular vein disappears, and when he lays back down, I notice it's at about a 45-degree angle, so that's normal. So I'm going to have you lay back down for me. And now I'm just inspecting the abdomen. I'm noticing the skin color and that the umbilicus is symmetrical. I'm not seeing any scars, any pulsations. I'm noticing that it's a flat puncture, and then so all the skin inspection is normal on the abdomen, and now I'm going to osculate the abdomen. There's 4 quadrants that I'm going to listen to, and I'm going to listen to the aortic, the renal, the iliac, and the femoral when I osculate. And as I'm doing that, I'm rotating clockwise. Bowel sounds were present. I didn't notice anything abnormal. And after I osculated, I'm going to percuss. You always want to osculate first. I'm going to percuss the 4 quadrants, and then I'm going to percuss for the liver, the stomach area, the spleen. So I'm going to go ahead and do that. And while I'm doing this, I'm going to look for tympany, and I'm going to look at the, make sure I see the liver span, which is normal 6 to 12. So I'm going to go ahead and get my ruler back out, and I'm going to percuss. Okay, his is about 8, so that's normal. And after I percuss, I'm going to palpate. I'm going to start with light palpations. You tell me if there's any tenderness or anything like that, and then I'm going to go to deep palpations. So I'm going to start with the 4 quadrants. And then I'm going to move clockwise. I'm going to look for the liver, which is on the right side. And then this, I'm going to try to find this spleen. And this spleen is non-palpable, so I shouldn't be able to feel that, which I don't. And I'm also going to feel for the kidneys. And I'm not noticing any masses, no edema, no distension, no fluids. And did you have any tenderness while I was doing that? So no tenderness either. And now, if you want, I'm going to have you scoot up just a little bit. There you go. And I'm just going to inspect the musculoskeletal system, and I'm going to inspect, palpate, and give range of motion all at the same time. First, I'm going to start with the upper extremities. I'm checking the muscles and the joints. I'm not noticing any crepitus or edema, any masses. Are you having any pain as I'm doing this?
No.
Okay, and there's no enlargement of those muscles. And I'm also going to do my lower extremities as well. Okay, and there's nothing, I'm not noticing anything abnormal through them. So when I had him stand up earlier, I inspected his spine. There wasn't any tenderness because he wasn't complaining. The configuration was all normal. There was the alignment, like I said earlier, was normal, and I didn't notice any scoliosis or deviation of the spine. So I'm going to have you sit back up and turn towards me again. And I'm just going to do the neurological portion of the physical assessment now. His mental status, as he came in before, as I said before, he was alert and oriented times 4. When he's talking to me, his speech was clear. He walked in with a normal gait. His balance was good. Looked like his coordination was good. So I'm actually going to do the Romberg test on him. I'm going to have you stand up for me. And as he's doing this, I'm looking for any swaying or anything like that. Close your eyes for me. Okay, you can have a seat now. I'm not noticing any swaying, so everything appeared to be normal there. I'm going to have you touch each finger to your nose for me. Okay, and now we're going to do the heel to shin. Okay, so coordination appeared to be good on that. And we're going to check the sensory portion now. I'm going to have you close your eyes for me. We're going to do a light touch. I just want him to tell me where he can feel it on his face. So close your eyes for me.
Left cheek.
Okay.
Forehead.
Okay. So the light touch, he did have light touch. And now I'm going to go ahead and do the, I'm going to check the other sensory portions of him. I'm going to draw a figure in your hand, and I want you to tell me what that is. So close your eyes for me.
E.
Okay. So I wrote the letter B in his hand, and he realized that it was a letter B. I'm also going to do the 2-point portion of it. I'm going to put a paper clip, and I want you to tell me when you feel the 2 points connect together. Okay. So 2-point was correct, and now we're just going to do one more part of it. We're going to do the sharp dull. So I want you to tell me if you feel sharp or you feel dull on your hand.
Dull.
Okay.
Sharp. Dull. Sharp.
Okay. So that part, all of his sensory motor skills looks like to be nothing abnormal. So now we're going to go ahead and check his reflexes. You grade reflexes also. 2+ is normal, so I'm going to start with the bicep reflex. Okay. Okay. That was a 2+, and now we're going to check the tricep, which is at the back of the elbow. Okay, that was a 2+. Okay, that was also a 2+. And now I'm going to go ahead and check the brachial radialis, which is at the wrist. 2+, 2+, and now I'm going to check the quadriceps reflex, which is at the knee. Okay, and those are both 2+, and you can also check the supine, where you'll have them lay down and you will use your armrest for that. And the Achilles reflex, I'm fixing to do those. You also check those. The 2+ for the Achilles reflex, 2+ for the Achilles reflex, and you'd also do a supine Achilles reflex also. So I'm going to have you lay back for me. Okay. and that was just the supine quadricep reflex. And then the plantar reflex, I'm just gonna draw Jay on his foot and see if his toes flare out. Okay, so that was also a 2+, so he got a 2+ on all his reflexes. You can sit back up for me. So that completed my physical assessment, so thank you, Ty, for working with me. And as I discussed before, beforehand, I noticed his general appearance. I did the Snellen and eye chart. We went over the breast and the penis and rectum area, and I think that's it. So thank you.